次は国境を越えた地域医療支援機構ならではの企画なんですけども、コロナ対策、去年からずっとフィリピンに、ちょっと自分自身は行けないんだけども、フィリピンの長崎大学の研修拠点のあるフィリピン国立感染症病院、サンラザロ病院の長崎大学のチームを率いている長崎大学の熱帯学グローバルヘルス研究科教授のクリス・スミス先生からお話をいただきます。クリス先生は長崎大学とパートナーシップを結んでいるロンドン大学から派遣されて、長崎大学ので臨床熱帯学を教えてくださっている先生です。残念ながら英語の講義になるんですけども、途中で私の方で少し補足説明をさせていただきますので、皆さんなんとか頑張ってスライドだけでも見て、内容を理解してください。Professor Chris Smith, can you start? I may interrupt you from time to time to give some supplementary explanations to what you saying. Yeah, please start.
Thank you very much, Ariyoshi Sensei. Ohayou gozaimasu, and I'm sorry, but Eigo lecture. My Japanese is not so good. I will try to speak slowly. Thank you very much for the invitation to speak today. I'm going to talk mainly about COVID-19 research in the Philippines. As Ariyoshi Sensei mentioned, I have a sort of split position between the School of Tropical Medicine and Global Health, Nagasaki University, and London School of Hygiene and Tropical Medicine. So it's part of this broader institutional partnership, and there's more information about this on the TMGH website. If you don't mind, just by way of very brief introduction, I did medical.
Chris, can you stop before you're moving on to the step? Okay. クリス先生は今私が言ったようにロンドンから来ている先生で、今日に関してはフィリピンで自分たちが行っている研究を中心にお話をさせていただきたいと思います。これがちょっと私の自己紹介をします。Okay, please go on.
Thank you. So I did my medical training in the UK as in the hospital and in primary care GP, and I've had the chance to work in 3 different continents in different capacities in Belize and Uganda and Cambodia. And then I did my research training at the London School of Hygiene and Tropical Medicine, master's, PhD, and was doing sexual and reproductive health research, and been very fortunate to have the opportunity to come and work in Nagasaki University in Japan. And what I'll talk a little bit today is of our DTM&H course and the research we've been doing in the Philippines, and also to mention I had a very nice opportunity to work as a WHO consultant for the COVID response in Papua New Guinea.
はい、私はイギリスの医師でありまして、これ長崎に来るまで3つの世界の大陸、1つはベリーズという中南米、1つはウガンダ、アフリカ、それから3つ目がアジアのカンボジアで仕事をしてきました。今、ちょっと今日はですね、DTMH という熱帯医学専門医ディプローマコースについてもお話をさせていただきたいと思います。それから最近 WHO のコンサルタントとしてパプアニューギニアに新型コロナの対策に行ってきました。
So just to briefly mention our DTM&H course we established 3 years ago in Nagasaki. It's a around 10-week intensive full-time course to teach doctors about how to manage conditions which are found in tropical or low-income settings or more common in those settings. It's accredited by the American Society of Tropical Medicine and Hygiene, and I'd just like to draw your attention to it. There's more information on the TMGH website, and it's something you may want to consider if you're thinking to work overseas or you're doing infectious disease training.
これは3年前から私が始めているDTMH というものです。熱帯医学の専門医コースで熱帯地で特有な病気に対して理解を深めて、すぐに活躍できるようなそういった医師を育てています。でこれはアメリカの熱帯医学会で承認を受けています。どうぞ。Please, over.
And we recognize that medical doctors in Japan are very busy and it's difficult to take time off. So we're hoping to launch an online tropical medicine course this year, which will be doctors will be able to do in a part-time capacity. So it will be 6 months instead of 3 months, and an opportunity to either join the lectures online or watch the videos in their own time. And so not quite as intensive as a DTM-NH, but another, maybe a nice option for doctors who want to study at the same time as they're working. And there'll be more information also on the website about this course.
一方で、先ほどの DTM-H というのは3ヶ月長崎に来て学ぶインテンシブな集中講義なんですけど、なかなか日本の先生方は忙しくて難しいだろうということで、6ヶ月のオンラインで学ぶコースっていうのも始めました。詳細はこの下にありますので見てください。Over.
And then we have the Philippines tropical medicine course, which was originally part of the DTM-NH, but because of COVID, we've had to split it off. So unfortunately, with the travel restrictions, it's been very difficult. So this will be held as a separate 2-week course when the travel becomes possible again. And we did it in 2019. We spent 1 week in Manila and a second week in a more rural setting on Leyte Island. So this was really nice, practical, hands-on learning course.
それに加えて、フィリピントロピカルメディスンコースというのもセッティングスタートしました。これは2週間のコースで、最初は最初の DTM-H の一部としていたんですけども、コロナの関係で、一緒にやることが難しくなったので、これを分けて行うことになりました。Over.
Most of the time in Manila, we were based in a hospital called San Lazaro Hospital, which is a hospital in a very high density kind of slum area in Manila, where they see a wide variety of patients with infectious diseases.
先ほどのフィリピントロピカルメディスンコースはマニラとマニラの外の田舎のフィールドの研修なんですけども、我々の活動の大部分はこのマニラの中の先ほど申しました国立感染症病院の中で行っています。どうぞ。
Such as the diseases we can see here, which we rarely see in Japan or the UK, with dengue fever, leptospirosis, rabies, tetanus, typhoid, diphtheria, etc., and large numbers of these patients.
これがこの病院で見ている入院する患者さんのリストですけども、日本やイギリスでは見ないようなデング熱とか、それからレプトスピラ症、それから狂犬病、破傷風、腸チフス、ジフテリア、そういったものが見られます。Over.
And Nagasaki University has had quite long-standing collaboration with San Lazaro Hospital, and it was more formalized since 2015. And Nagasaki has established a small laboratory with various diagnostic test capacity, and has some staff, lab technicians and research nurses, etc., and has been conducting research on these tropical infectious diseases, such as listed here. So it's a research and education collaboration with sort of bi-directional learning, and opportunity for students from Nagasaki to visit San Lazaro Hospital, and of course for DTM-NH.
長崎大学はこのサンラザロ病院とも長年にわたって共同研究だけじゃなくて共同で教育をしました。先ほど申しました DTM-H ともそのうちの一つです。長崎大学はこの病院に新しいその感染症を診断するためのラボラトリーを設置しました。
And the first few years of the research collaboration has focused on diseases like leptospirosis, TB, diphtheria, rabies, and the backbone of this research has been a community-acquired bacteremia study. So various publications have been done in this field, and our intention was in 2020 that we would continue doing this kind of research.
2020年の前は、その長崎大学はそのサンラザロ病院でこのような研究活動をしてきました。
And then, of course, COVID came along. As you know, Japan was quite early first case, and the same in the Philippines on January the 31st. And of course, we had no idea, what was going to happen in reality. but we were considering in this time, what our response may be to this new infection.
2020年、皆さんご存知のように、初頭からフィリピンでも、コロナが始まりまして、日本では1月の16日に最初のケースですけども、フィリピンは1月の31日に最初のケースが見つかりまして、それはこのサナザル病院です。その後、何が起きるのかわからない状態で我々その研究活動を始めました。
So the San Lazaro Hospital had the first case of COVID in the Philippines, and it's been very hard hit. The Philippines has now become the most affected country in the Western Pacific region, and many cases have been admitted to San Lazaro Hospital, and it's been very tiring for our colleagues, healthcare workers there.
フィリピンはご存知のように西大西洋地域では最も新型コロナによって被害を受けた国であります。ここにあるようにです。サンラザル病院も感染症病院ですので、例外ではなくてこのように。
So initially we were wondering how to respond, and we heard from the hospital they were very short on the PPE. So these are some pictures of Ariyoshi Sensei managed to get some donation of PPE, and we are loading PPE into his car and transporting it to San Lazaro Hospital. So this is in the February 2020.
最初の段階ではPPE でさえなかったので、それを日本から現地に送るということをやっていました。Over.
And this is a situation in February and March. The travel restrictions are increasing. There are a few cases, but many suspected. There are very challenging situation with diagnosis. There are very few diagnostic labs in the Philippines, shortage of PPE. So we are really wondering what's going to happen next. Will there be a lot more transmission or not? Can we set up the decentralized testing, and what are the research priorities moving forward?
2月3月の時点では本当に PPE だけじゃなくて、検査も国全体でどこにもできないというような状況がありました。そこで、サンラザル病院の中でも検査ができるようになるか、そうやって何が起きているのかって調べたいと思いました。Okay, over.
So during those early days, we were just about able to travel and able to send over some scientists from Necken, Inoue Sensei, Takemura came from Vietnam, and together with colleagues Tatsuo Kawa, and then we were able to establish the PCR in San Lazaro Hospital and acute respiratory infection multiplex panel. So this was really useful for the hospital.
はい、そこで2月なんとかまだ我々は投稿することができましたので、PCR の検査を現地に技術移転することをしました。Over.
And we really had to adapt then for a new way of working. So from February, this is probably the last photo when I was in Philippines, and the staff have been there working extremely hard throughout this time, and we have been working by remote and by Zoom, and really the only person who's been able to travel has been Jack Suzuki, who's the one who's been moved between Japan and Philippines during this time.
これは我々長崎大学のスタッフでありますけども、3月以降は投稿することが難しくなったんですけど、その丸の中にいる鈴木さんという方だけがなんとか現地でとどまって活動を続けています。
And during this time, we set up a research study, and it was about epidemiological and clinical features of acute respiratory infection, including COVID in SLH. And we designed this study to try to be as flexible as possible and adapt to different situations. So I will go through just briefly some of these objectives and our outputs in the next few slides.
Okay, please keep going. これが研究のその時にスタートした研究の内容です。
So one objective was to look at characteristics and clinical outcomes of patients with suspected COVID through retrospective and prospective enrollments.
一つはどのような患者さんが来ているのか明らかにするということです。Please go on.
So we were able to write the first case report of COVID case in Philippines, which we published and has had quite a lot of access over the last few months.
例えば一番最初にフィリピンで確認された症例、そして中国国外で亡くなった症例について私たちはケースレポートとして世界に発信することができました。
And we also wrote a series of the first 100 suspected cases in coming to San Lazaro Hospital to try to aid clinician in identifying who may be COVID case or non-COVID case.
最初の100の疑似症例を見ることによって、どれが本当の COVID かどうかということを最初の段階で示すことができました。
And also did a small publication looking at the change in the demographic in the early stages of the epidemic, where cases started to move from outside and towards the slum high density areas.
そして当初フィリピンでは感染が、マニラの周辺の地域、特に外国人との、交流の多いところから始まって、それがスラム街のある中心の方に移ってきているということも報告しました。Over.
And then more recently, we've done an analysis of the first 500 confirmed cases coming to San Lazaro Hospital, and we looked at the risk factors for mortality.
そして最近では最初の500の確定症例に関して、亡くなる方のリスクなんかについても報告しました。
And in terms of prospective enrollment of patients, we've done some screening of patients and staff on the TB ward, which we described in this short report.
前向きのスタディとしては、その結核病棟で起きた院内感染のサスペクトをスクリーニングするためのこともやりました。次の、over.
We described our screening of healthcare workers in the hospital in this short paper in American Journal of Tropical Medicine and Hygiene, identifying different clusters amongst healthcare workers.
私たちはヘルスケアワーカーの中のスクリーニングを行って、実はヘルスケアワーカー自身の中でクラスターが起きているということも見つけ出しました。Over.
And this one, if not COVID, what is it? We described a bit some of our made the potential role of ARI screening in addition to COVID alone, and how this could potentially provide some reassurance for healthcare workers.
そしてもし COVID じゃない、疑似症例で COVID じゃない場合はどういう他の呼吸器感染症になっているのかということについても調べました。Over.
In terms of looking at immune response profile using serology and immunoassays, we've been doing some work among screening patients attending the animal bite clinic. So they're going there for rabies post-exposure prophylaxis. And we've done some screening to try to get some estimates of immunity in the community.
血清研究も行いました。それは狂犬病外来という、月々2000症例ぐらい来ている外来があるんですけど、そこに来ている人たちをランダムに選んで、地域の中でどのぐらいの方がもう抗体が陽性になっているのかということについても調べました。Over.
So this is work in progress, but we were quite surprised at the increase in seropositivity over time, from 11% up to more than 40%. And the line in blue is showing the PCR positivity amongst
これは我々も非常に驚いたことなんですけど、去年の9月の時点ですでに、抗体陽性率っていうのは 50% 近くにまで跳ね上がっているということを見つけました。Over.
We also had the chance to check serology of more than 600 healthcare workers the day just before receiving vaccination. And this was with some antibody kit donated by WHO, and we found that around 1/3 of healthcare workers had antibodies prior to vaccination.
WHO との共同で、協力を得てサンラザル病院で働いているヘルスケアワーカー、医療従事者のワクチンを打つ前の血清についても調べました。
The sequencing is a work in progress. So perhaps in summary, the Philippines has been hit pretty hard by COVID. And what we're trying to do as a Nagasaki side is try to contribute to the knowledge of what's happening in this setting by doing our epidemiological analyses and screening, and enable this data to be compared with elsewhere and hopefully aid clinical management and be useful for mathematical modeling. We have some work in progress still with our animal bite center surveys and healthcare worker surveillance, which we feel is very more important now as we're moving into this new era of vaccine and variants and concern about the waning immunity, etc.
ということで、フィリピンはアジアの中で最もヒットされた国であるわけなんですけども、病院の中にいながら、その国の感染症対策、あるいは臨床に役立つような情報を我々はなんとか情報発信をしてきました。今、先ほど申しましたように、狂犬病外来であるとか、それから今の病院の医療従事者のサーベイランスを続けることによって、今後も、貢献していきたいと思っています。
So thank you very much for your time. My contact details are here and the link to the TMGH website for the DTMNH, but please get in touch regarding the DTMNH or Philippines research or anything like that. So thank you very much for the opportunity to speak today, Ariyoshi Sensei. I finished now.
皆さんご清聴ありがとうございました。今後もしDTMH に興味のある方、私に興味のある方はぜひこちらにコンタクトしてください。以上です。Thank you very much, Chris. Thank you very much.
Thank you.
ということで、ちょっと日本語を中に入れながらでしたので、どうしても時間オーバーになってしまったんですけども、皆さんお聞きされていて、何か全体を通じても結構ですし、最後のクリス先生に対しての質問でもいいんですけども、日本語でいただければ用意しますので、もし何かありましたらどうぞ。もしなければですね、本当に皆さん今日はありがとうございました。それぞれ、上五島、それから北海道、それからマニラ、フィリピンで、皆さんこの1年間とても頑張っていらっしゃったんだなということを本当に実感いたしました。ありがとうございました。それで一応このセッションを終わりで中岡先生の方にマイクを返したいと思います。よろしくお願いします。ありがとうございました。